Still on health, in recent times, men, especially the younger generation, willingly donate or sell their sperms either to help a loved one or a needy couple. For some, this service is complicated. For others, it answers a prayer and grants a wish, while to another group, it is another quick way to make some money. Our next report looks at sperm donation or its sale and what it entails.
A sperm is very important in the reproduction process. A healthy sperm is determined by quantity, quality and motility. For the millions of sperms in the reproduction process, it is a survival of the fittest, which will later develop into a human being. There are varied reasons why some couples are unable to have biological children. The options available, therefore, would be either to adopt, have a surrogate or get a sperm donor. When artificial insemination became popular as an alternative to natural conception in the 1970s, couples visited fertility hospitals for their own sperms and eggs to be fertilized in order to carry their own children to term. Over time, men started donating or selling their sperms to known or unknown recipients. These men are often between the ages of 18 and 40 years and are mostly students and professionals. A recipient can choose from an endless list of donors: high IQ, fair or dark in complexion, tall, hairy, a footballer or an artist. The Chief Executive Officer of Leicester Hospital and Fertility Center, who is also a fertility specialist, Dr. Edem Kojo-Hiaji, explains the requirements.
You want certain data. It's easier using a questionnaire than asking one-on-one. If there are any areas you want to go into, then you discuss those. You would only hope that people give you the truth. In some places as well, they do criminal check, so you can check from the CID screen. Could you please check if this person has any criminal? But we are not sophisticated to that level yet here. So as we develop and grow, those will all be taken account of.
Prior to the procedure, a donor is thoroughly screened. Dr. Hiaji tells us more about the process.
There is the physical screening, medical screening, and then the social screening. The medical aspects, whether the person has certain diseases. So you will screen for sickle cell, HIV, hepatitis. Some may be genetic. And then socially, you want to know the person's academic achievements, their skills, their hobbies. Once they pass the test, then the actual process of sperm production takes place. But with sperm production for sperm donation, normally is by masturbation. So you get a private room for the person, and then they masturbate, produce the sperm in a sterile container, and then give it to the embryologist who will assess it.
The sperms are stored in a sperm bank, and after medical screening, artificial insemination takes place. Asked whether the donor gets to meet the recipients, Dr. Hiaji replied in the negative.
It is not right. First of all, they do not have any obligation to the child that is born. Neither do they have any rights. If you donate, you are remunerated for it. And once you're remunerated, it ends there. You signed the form that you are not going to pursue anything.
But some recipients choose to come along with their own donors. An example is a lady married for 15 years without a child. She paid a student from the University of Cape Coast 12,000 Ghana cedis to donate her sperms. She was artificially inseminated twice and now has 2 children. According to Dr. Hiaji, physically there are no implications, but medically, if the screening is not properly done, it could spread diseases.
Physically, it's not a big issue. You must do a good job before offering that sperm out to a recipient. And probably it's only in the future that we would know about the psychological and social implications. when these children grow up and are demanding to know more about the father.
Denmark is known to have a well-developed system for human sperm export. The fee paid to donors is what makes sperm selling a magnet to some. In Ghana, the fee ranges from 100 Ghana cedis to about 10,000 Ghana cedis, depending on the specifications.
Some places where you want specifics, like you want a film star, you could be paying some $20,000 for a vial of sperm. That is even if the person wants to give it at all.
Students, especially from tertiary institutions, are some of the specifications of choice. Some say they use the money to pay their fees and also help friends in need. A level 400 political science student at the University of Ghana, Legon, who spoke off camera, said one of his friends was paid a large sum of money for donating. He said he was also willing to be a donor for $10,000 US.
It has been happening, but the problem is that some of us don't actually see it physically, but we have been hearing it around here and there. I will basically encourage people to donate sperm, but not for an amount of money. But in case you want to donate sperm, I will encourage you also to make a follow-up, because the sperm contains your child.
Once it gives them the money and whatever they want, fine, it's cool.
So, because of the large sum of money involved, some women now look for willing donors for a minimal fee. Dr. Edem Kojo-Hiaji cautioned when selling sperms, since it involves lives. An argument that sometimes arises is whether it is religiously, ethically or practically right to allow a loved one to sell sperms to a complete stranger.
On that story, we take a break. We'll be